Question 1. Implementation of a group therapy session reveals increased tension among members, with disagreements surfacing regarding group rules and the counselor's facilitation style. Some members express frustration with others' contributions, while a few appear withdrawn. The counselor observes a pattern of challenging authority and a struggle for individual expression versus group cohesion. Considering the typical progression of group development, which of the following best describes the counselor's assessment and appropriate next steps? Option A. The group is in the adjourning stage, and the counselor should focus on summarizing progress and preparing members for termination. Option B. The group is in the forming stage, and the counselor should provide clear structure and direction to establish initial trust and define group purpose. Option C. The group is in the performing stage, and the counselor should encourage members to focus on achieving their individual goals and celebrate collective successes. Option D. The group is in the storming stage, and the counselor should facilitate open discussion about the conflicts, explore underlying anxieties, and reinforce norms for respectful disagreement to help the group navigate this phase. The correct answer is D. The group is in the storming stage, and the counselor should facilitate open discussion about the conflicts, explore underlying anxieties, and reinforce norms for respectful disagreement to help the group navigate this phase. Explanation. This scenario presents a common challenge for counselors facilitating group therapy, navigating the dynamic shifts in group cohesion and member engagement as the group progresses through its developmental stages. The counselor must accurately assess the current stage to select appropriate interventions that foster therapeutic progress and adhere to ethical guidelines for group work. The challenge lies in distinguishing between superficial participation and genuine engagement, and in understanding how different developmental stages require different leadership styles and therapeutic focuses. The correct approach represents best professional practice because it aligns with established models of group development, such as Tuckman's stages: forming, storming, norming, performing, adjourning. By recognizing that the group is exhibiting characteristics of the storming stage, marked by conflict, resistance, and challenges to leadership, the counselor can implement interventions specifically designed to address these dynamics constructively. This includes facilitating open communication about disagreements, exploring underlying anxieties, and reinforcing group norms that encourage respectful conflict resolution. Such an approach is ethically sound as it prioritizes the therapeutic needs of the group members, promotes a safe and productive environment, and demonstrates competence in group facilitation as outlined by professional counseling standards, which emphasize understanding and responding to the evolving needs of the group. An incorrect approach would involve misinterpreting the group's behavior. For instance, viewing the conflict and resistance solely as a sign of poor group cohesion, without recognizing it as a natural part of the storming stage, could lead to premature attempts to force conformity or to shut down necessary conflict. This would be an ethical failure because it neglects to address the underlying developmental needs of the group, potentially hindering progress and creating an environment where members feel unheard or invalidated. Another incorrect approach might be to ignore the conflict altogether, hoping it will resolve itself. This would also be an ethical failure, as it represents a lack of active facilitation and a failure to provide the necessary structure and guidance for the group to move through this challenging phase effectively. Furthermore, applying interventions suitable for the performing stage, such as focusing on advanced problem solving, would be inappropriate and counterproductive if the group has not yet successfully navigated the storming and norming stages, demonstrating a lack of understanding of group dynamics and potentially leading to frustration and disengagement. The professional decision-making process for similar situations involves a continuous cycle of observation, assessment, intervention, and evaluation. Counselors should actively observe group interactions, paying attention to communication patterns, levels of engagement, and expressions of conflict or agreement. They should then assess these observations against established models of group development to determine the most likely stage the group is in. Based on this assessment, the counselor selects interventions that are stage-appropriate and ethically aligned with the goals of group therapy. Finally, the counselor evaluates the impact of their interventions and adjusts their approach as needed, remaining flexible and responsive to the group's evolving needs. This iterative process ensures that the counselor is providing effective and ethical support throughout the group's journey. Question 2. Governance review demonstrates that a counselor is utilizing an integrative and eclectic approach with a client experiencing complex trauma and co-occurring substance use issues. The counselor has identified interventions from psychodynamic, cognitive behavioral, and EMDR therapies. The review seeks to understand the rationale behind the selection and integration of these modalities. Which of the following best describes the counselor's approach in this context, adhering to NCE standards? Option A. The counselor applies techniques from each modality as they come to mind during sessions, believing that a broad exposure to different therapeutic tools will inherently benefit the client. Option B. The counselor utilizes a standardized protocol for each modality independently, without a clear plan for how these distinct protocols will be woven together to address the client's overarching issues. Option C. The counselor prioritizes interventions from their most extensively trained theoretical orientation, only incorporating elements from other modalities if the client explicitly requests them, and they align with the primary framework. Option D. The counselor systematically selects and integrates interventions from each modality based on the client's specific needs, treatment goals, and the evidence base for each technique, ensuring a cohesive and client-centered therapeutic experience. The correct answer is D. The counselor systematically selects and integrates interventions from each modality based on the client's specific needs, treatment goals, and the evidence base for each technique, ensuring a cohesive and client-centered therapeutic experience. Explanation: this scenario presents a professional challenge because it requires the counselor to navigate the ethical and practical implications of integrating diverse theoretical orientations within a single client's treatment plan, while adhering to the National Counselor Examination (NCE) standards. The counselor must demonstrate competence in selecting and applying interventions that are not only theoretically sound, but also client-centered and evidence-informed, without overstepping the boundaries of their expertise or engaging in practices that could be detrimental to the client's well-being. Careful judgment is required to ensure that the eclectic approach is a cohesive and purposeful strategy, rather than a haphazard collection of techniques. The correct approach represents best professional practice because it emphasizes a systematic and client-driven integration of therapeutic modalities. This aligns with ethical guidelines that prioritize client welfare and require counselors to practice within their areas of competence. By tailoring interventions to the client's specific needs, goals, and cultural background, the counselor demonstrates a commitment to individualized care. This approach also reflects an understanding of integrative and eclectic theories, which advocate for drawing from multiple theoretical frameworks to create a more comprehensive and effective treatment plan. Counselors' commitment to ongoing assessment and adjustment further reinforces best practice by ensuring the treatment remains responsive to the client's progress and evolving needs, consistent with the NCE's emphasis on client-centered care and professional development. An incorrect approach that involves randomly applying techniques from various theories without a unifying rationale represents a significant ethical failure. This can lead to fragmented and ineffective therapy, potentially causing harm to the client by confusing them or failing to address their core issues. Such an approach violates the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. It also demonstrates a lack of professional competence in applying integrative or eclectic principles, as these approaches require a thoughtful and informed selection of techniques, not a superficial borrowing. Another incorrect approach, focusing solely on the counselor's preferred theoretical orientation and disregarding the client's expressed preferences or the potential benefits of other modalities, is also ethically problematic. This can be seen as paternalistic and may lead to client dissatisfaction and disengagement, failing to uphold the ethical imperative of client autonomy and self-determination. Furthermore, it demonstrates a failure to engage in a truly integrative or eclectic process, which by definition involves a broader consideration of therapeutic options. The professional decision-making process for similar situations should begin with a thorough assessment of the client's presenting problems, strengths, cultural background, and treatment goals. The counselor should then consider various theoretical orientations and their potential applicability to the client's situation. This involves a critical evaluation of the evidence base for different interventions and a consideration of how they might be integrated into a cohesive treatment plan. The counselor must also engage in ongoing self-reflection and consultation with supervisors or peers to ensure the chosen approach is ethically sound, clinically effective, and aligned with professional standards. The client should be an active participant in this process, with their preferences and feedback being integral to treatment planning and modification. Question 3. Quality control measures reveal that a counselor utilizing Rogers' person-centered therapy is working with a client who expresses frustration with their current job and states, "I just need you to tell me what career I should pursue. I'm tired of feeling stuck." The counselor is considering several responses. Which of the following responses best exemplifies the core principles of person-centered therapy in this situation? Option A. Immediately providing a list of potential career paths based on the client's stated dissatisfaction, drawing from common career counseling resources. Option B. Offering an interpretation of the client's desire for external direction as a manifestation of underlying control issues, suggesting they explore this in future sessions. Option C. Suggesting that the client take a series of standardized career aptitude tests and then discussing the results to determine the most suitable career. Option D. Reflecting the client's feelings of frustration and stagnation and gently exploring what aspects of their current situation are most dissatisfying and what they envision for a more fulfilling work life. The correct answer is D. Reflecting the client's feelings of frustration and stagnation and gently exploring what aspects of their current situation are most dissatisfying and what they envision for a more fulfilling work life. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for a specific therapeutic outcome and the counselor's ethical obligation to adhere to a client-centered approach that prioritizes the client's self-exploration and autonomy. The counselor must navigate the client's potential impatience or misunderstanding of the therapeutic process while maintaining the core tenets of person-centered therapy. Careful judgment is required to balance empathy and genuineness with the non-directive stance. The correct approach represents best professional practice because it upholds the core principles of Rogers' person-centered therapy, which are foundational to ethical counseling practice within the National Counselor Examination (NCE) framework. Specifically, it emphasizes the counselor's role in providing a safe, non-judgmental, and empathic environment where the client can explore their own feelings and experiences. This aligns with the NCE's emphasis on client self-determination and the counselor's responsibility to facilitate the client's growth rather than imposing solutions. The counselor's focus on reflecting the client's feelings and experiences, without offering direct advice or interpretations, empowers the client to discover their own insights and solutions, fostering genuine self-understanding and change. This aligns with ethical guidelines that prioritize client autonomy and the counselor's role as a facilitator. An incorrect approach that involves the counselor offering direct advice or solutions would represent a failure to adhere to the person-centered model. This would be an ethical failure because it undermines the client's autonomy and self-efficacy, essentially taking away their agency in the therapeutic process. It also deviates from the core conditions of empathy, congruence, and unconditional positive regard, as it implies the counselor knows what is best for the client, which is contrary to the person-centered philosophy. Another incorrect approach, such as prematurely interpreting the client's statements or imposing a theoretical framework, would also be an ethical failure. This would violate the principle of allowing the client to lead the exploration of their own experiences and could lead to the client feeling misunderstood or invalidated, hindering the therapeutic relationship and progress. The professional decision-making process for similar situations should involve a continuous assessment of the client's needs within the context of the chosen therapeutic modality. The counselor should first and foremost ensure the core conditions of person-centered therapy are present: empathy, congruence, and unconditional positive regard. When a client expresses a desire for a specific outcome or solution, the counselor should reflect this desire back to the client, exploring their feelings and thoughts about it, rather than immediately trying to fulfill it. The counselor should ask open-ended questions that encourage further self-exploration, such as "How does that idea feel to you?" or "What do you imagine would happen if?" This process allows the client to explore their own motivations and potential solutions, reinforcing their self-direction and therapeutic growth. Question 4. Process analysis reveals that a counselor is reviewing progress with a client who reports feeling significantly better and more hopeful about their future. However, the counselor has observed a consistent pattern of increased social withdrawal, difficulty initiating tasks, and a lack of engagement in previously enjoyed activities during sessions. The counselor needs to determine the most appropriate next step in monitoring this client's progress. Option A. Conclude that the client is not making progress and recommend termination of services due to the apparent contradiction between their self-report and observable behaviors. Option B. Accept the client's self-report at face value and document that the client feels significantly better, focusing future sessions on reinforcing this positive self-perception. Option C. Prioritize the counselor's observations of social withdrawal and task initiation difficulties, adjusting the treatment plan to address these objective indicators without further discussion of the client's subjective feelings. Option D. Engage the client in a discussion about the discrepancy between their reported feelings and the counselor's observations, exploring specific examples and collaboratively reassessing the progress towards their stated goals. The correct answer is D. Engage the client in a discussion about the discrepancy between their reported feelings and the counselor's observations, exploring specific examples and collaboratively reassessing the progress towards their stated goals. Explanation. This scenario presents a common challenge in counseling, effectively monitoring client progress when the client's subjective experience and objective indicators appear to diverge. The professional counselor must navigate this discrepancy while adhering to ethical guidelines and best practices for progress monitoring, which are paramount for client welfare and professional accountability. The challenge lies in interpreting client self-reports, counselor observations, and any collateral information in a way that accurately reflects the client's journey and informs future interventions. The correct approach involves a comprehensive and collaborative review of progress. This means actively engaging the client in discussing their perception of change, comparing it with observable behaviors and symptom reduction, and jointly assessing whether treatment goals are being met. This collaborative method aligns with ethical principles of client autonomy and informed consent, ensuring the client is an active participant in their treatment. It also reflects best practices in progress monitoring by utilizing multiple data points, client report, counselor observation, goal attainment, to form a holistic picture. This approach is supported by the ethical codes that emphasize ongoing assessment and the need for interventions to be responsive to client needs and progress. An incorrect approach would be to solely rely on the client's self-report, especially if it contradicts observable evidence or the counselor's professional judgment. This failure to integrate objective data can lead to a misinterpretation of the client's actual functioning and potentially prolong ineffective treatment. Ethically, this could be seen as a lapse in due diligence and professional competence, as it neglects a crucial aspect of assessment. Another incorrect approach is to dismiss the client's subjective experience entirely and focus only on objective measures. This can alienate the client, undermine the therapeutic alliance, and fail to acknowledge the client's lived reality, which is a critical component of their experience of change. This approach violates the principle of respecting the client's perspective and can lead to a breakdown in trust. A third incorrect approach might involve making significant changes to the treatment plan based on a single, isolated observation without further exploration or client input. This lacks the systematic and collaborative nature of effective progress monitoring, potentially leading to premature or inappropriate interventions. The professional decision-making process for such situations should involve a systematic approach. First, acknowledge and validate the client's reported experience. Second, gather objective data through observation, standardized measures, if appropriate and not math-focused or collateral information. Third, collaboratively discuss the discrepancies and convergences between subjective and objective data with the client. Fourth, jointly reevaluate progress towards established goals. Finally, adjust the treatment plan collaboratively based on this comprehensive assessment, always prioritizing the client's well-being and therapeutic alliance. Question 5. Investigation of a counselor's personal feelings of judgment towards a client's life choices, which are beginning to impact the objectivity of their therapeutic interventions, raises questions about how to ethically manage this situation within the NCE framework. Option A. Terminate therapy abruptly due to personal discomfort, without exploring the underlying countertransference or ensuring a smooth transition of care for the client. Option B. Acknowledge the countertransference, seek immediate supervision to process these feelings, and collaboratively develop a plan to ensure the client's needs are met, which may include a referral if personal biases cannot be adequately managed. Option C. Continue therapy as usual, attempting to suppress personal feelings of judgment to maintain a professional demeanor, believing that the client will not be aware of any subtle shifts in the counselor's approach. Option D. Directly express personal opinions and concerns to the client about their choices, framing it as a way to help them see a different perspective and make better decisions. The correct answer is B. Acknowledge the countertransference, seek immediate supervision to process these feelings, and collaboratively develop a plan to ensure the client's needs are met, which may include a referral if personal biases cannot be adequately managed. Explanation. This scenario presents a professional challenge because the counselor is experiencing a countertransference reaction that is interfering with their ability to provide objective and effective treatment. The counselor's personal feelings about the client's choices are clouding their judgment, potentially leading to biased interventions or a premature termination of therapy. Adhering to the ethical principles of the National Counselor Examination (NCE) framework requires the counselor to prioritize the client's well-being and maintain professional objectivity. The correct approach involves recognizing the countertransference, seeking supervision or consultation, and potentially referring the client if the issue cannot be resolved. This aligns with NCE ethical standards that mandate counselors to be aware of their own biases and limitations, and to take steps to prevent them from harming clients. Seeking supervision is a cornerstone of ethical practice, providing a safe space to explore difficult feelings and develop strategies to manage them, ensuring the client's needs remain paramount. This proactive step demonstrates a commitment to professional competence and client welfare, as outlined in ethical codes that emphasize self-awareness and the pursuit of professional growth. An incorrect approach would be to ignore the feelings and continue therapy as if nothing were happening. This fails to acknowledge the impact of countertransference on the therapeutic process and violates the ethical obligation to provide competent and client-centered care. Another incorrect approach would be to terminate therapy solely based on personal discomfort without exploring alternatives or ensuring a proper referral. This could be seen as abandoning the client and not acting in their best interest, which is a direct contravention of ethical mandates. Finally, acting on personal judgment and attempting to subtly influence the client's decisions based on the counselor's own values would be a severe ethical breach, violating client autonomy and the principle of non-maleficence. Professionals should employ a decision-making process that begins with self-monitoring for signs of countertransference. Upon identification, the next step is to consult with a supervisor or a trusted colleague to gain an objective perspective and develop a plan. This plan might involve exploring the countertransference in supervision, implementing specific therapeutic strategies to manage it, or, if necessary, considering a referral to another professional who can offer unbiased care. This systematic approach ensures that client welfare remains the primary concern and that ethical guidelines are upheld throughout the therapeutic relationship. Question 6. What factors determine the most effective way for a counselor to reflect a client's expressed feelings and underlying meanings during a session, considering the client's emotional state and the need to build therapeutic rapport? Option A. Sharing personal anecdotes to demonstrate empathy and build a connection. Option B. Offering immediate advice and solutions to address the client's stated problems. Option C. Accurately capturing the client's perceived emotions and the essence of their message to validate their experience. Option D. Paraphrasing the client's exact words to ensure factual accuracy of the content. The correct answer is C. Accurately capturing the client's perceived emotions and the essence of their message to validate their experience. Explanation. This scenario is professionally challenging because the counselor must navigate the client's emotional distress while ensuring their communication is both empathetic and therapeutically effective. The core of the challenge lies in accurately perceiving and reflecting the client's underlying feelings and meanings, rather than just the surface-level content of their words. This requires a high degree of attunement and self-awareness on the part of the counselor. The correct approach represents best professional practice because it directly aligns with core counseling principles and ethical guidelines, particularly those emphasizing client-centered therapy and the importance of accurate empathy. Reflective listening, when done effectively, validates the client's experience, builds rapport, and facilitates deeper self-exploration, demonstrates to the client that they are heard and understood, which is foundational to the therapeutic alliance. This approach is supported by the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as misinterpreting or dismissing a client's feelings can be detrimental to their progress. An incorrect approach that focuses solely on offering solutions or advice prematurely fails to acknowledge the client's emotional state. This can lead to the client feeling unheard, invalidated, or misunderstood, potentially damaging the therapeutic relationship and hindering their willingness to disclose further. Ethically, this approach could be seen as a failure of competence, as it does not employ a recognized and effective therapeutic technique for addressing emotional distress. It also risks imposing the counselor's agenda rather than facilitating the client's own process. Another incorrect approach that involves paraphrasing the client's words without attempting to capture the underlying emotion misses a crucial element of reflective listening. While paraphrasing can confirm understanding of content, it lacks the empathic depth needed to connect with the client's feelings. This can leave the client feeling that their emotional experience has been overlooked, leading to a superficial therapeutic interaction. This approach could be considered a failure to adhere to the principle of accurate empathy, a cornerstone of effective counseling. A third incorrect approach that involves interrupting the client to share personal experiences or anecdotes, even with good intentions, shifts the focus away from the client and onto the counselor. This not only disrupts the client's narrative flow, but also can be perceived as a lack of focus on the client's needs. Ethically, this is a boundary violation and a failure to maintain a client-centered focus, which is paramount in counseling. It undermines the therapeutic purpose of the session and can create an imbalance in the relationship. The professional decision-making process for similar situations involves a continuous assessment of the client's verbal and nonverbal cues. The counselor must first actively listen to the client's message, both content and effect. Then they must formulate a reflection that accurately captures the perceived feeling and meaning, often starting with phrases like, "It sounds like you're feeling," or "So, you're saying that." The counselor then observes the client's response to gauge the accuracy of their reflection and adjust their approach accordingly. This iterative process ensures that the counselor remains attuned to the client's experience and adapts their interventions to best serve the client's therapeutic goals. Question 7. When evaluating a client's presentation, which approach best balances the need for accurate assessment with respect for cultural diversity and the client's unique worldview? Option A. Directly challenging and reframing the client's cultural beliefs if they appear to contradict evidence-based psychological principles, with the goal of accelerating their integration into mainstream society. Option B. Focusing exclusively on the client's immediate symptoms and behaviors, viewing their cultural background as a secondary or irrelevant factor that might complicate the therapeutic process. Option C. Applying standardized diagnostic criteria rigorously, assuming that mental health presentations are universally understood and treated, and encouraging the client to adapt to dominant cultural norms for faster progress. Option D. Prioritizing a thorough exploration of the client's cultural background, beliefs, and values to understand how these factors influence their presenting concerns and their perception of well-being, while also considering established diagnostic frameworks through a culturally sensitive lens. The correct answer is D. Prioritizing a thorough exploration of the client's cultural background, beliefs, and values to understand how these factors influence their presenting concerns and their perception of well-being, while also considering established diagnostic frameworks through a culturally sensitive lens. Explanation. This scenario presents a professional challenge because the counselor must navigate the intersection of a client's deeply held cultural beliefs and the potential for those beliefs to contribute to distress or maladaptive functioning. The counselor's role is to provide effective and ethical support, which requires a nuanced understanding of how cultural factors influence mental health and well-being, without imposing their own cultural values or making assumptions. Careful judgment is required to differentiate between culturally normative practices and those that may indicate a need for intervention, always prioritizing the client's autonomy and well-being. The correct approach represents best professional practice because it prioritizes a client-centered, culturally sensitive assessment. This involves actively seeking to understand the client's worldview, the meaning they ascribe to their experiences, and how their cultural background shapes their perceptions and behaviors. This aligns with ethical principles of respecting client autonomy, avoiding cultural bias, and practicing within one's scope of competence, as outlined by professional counseling standards that emphasize cultural humility and the integration of cultural considerations into all aspects of practice. An incorrect approach that focuses solely on Western diagnostic criteria without considering the client's cultural context fails to acknowledge the diversity of human experience and can lead to misdiagnosis or inappropriate treatment. This approach risks pathologizing culturally normative behaviors, violating the ethical principle of cultural competence, and potentially causing harm by imposing an alien framework on the client's lived reality. Another incorrect approach that dismisses the client's cultural beliefs as irrelevant or a barrier to treatment demonstrates a lack of cultural humility and can alienate the client. This approach disregards the profound impact of culture on identity and well-being, violating the ethical imperative to provide services that are sensitive and responsive to the client's cultural background. It can lead to a breakdown in the therapeutic alliance and prevent the client from receiving effective support. A professional decision-making process for similar situations should begin with self-reflection on one's own cultural biases and assumptions. This should be followed by a commitment to ongoing cultural education and training. In practice, the counselor should engage in active listening, open-ended questioning, and collaborative exploration with the client to understand their cultural framework. The focus should be on building a strong therapeutic alliance based on trust and respect, and interventions should be developed in partnership with the client, taking into account their cultural values and preferences. Question 8. Operational review demonstrates that a counselor has been asked by a client's insurance provider to provide a summary of the client's treatment progress for the purpose of continued authorization of services. The client has previously signed a general release of information form at the intake appointment. Which of the following actions best represents the counselor's ethical and professional responsibility in this situation? Option A. Proceed with creating and sending the summary to the insurance provider, relying on the general release of information form signed at intake. Option B. Provide a generalized, anonymized summary of treatment progress to the insurance provider, omitting all client-identifying information. Option C. Obtain specific, informed consent from the client for the creation and release of the treatment summary to the insurance provider, detailing the information to be included and the purpose of the summary. Option D. Summarize the treatment progress in a way that emphasizes the client's need for continued services, even if it means slightly exaggerating the severity of their condition. The correct answer is C. Obtain specific, informed consent from the client for the creation and release of the treatment summary to the insurance provider, detailing the information to be included and the purpose of the summary. Explanation. This scenario presents a professional challenge because the counselor is tasked with summarizing complex clinical information for a third party without direct client consent for the specific purpose of the summary. This raises significant ethical and legal concerns regarding client confidentiality and informed consent, as mandated by the National Counselor Examination (NCE) regulatory framework, which aligns with general ethical principles of professional counseling in the United States. The correct approach involves obtaining explicit, informed consent from the client for the specific purpose of creating and releasing the summary. This aligns with the ethical principle of client autonomy and the legal requirement for confidentiality. By seeking consent, the counselor ensures the client understands what information will be shared, with whom, and for what purpose, allowing them to make an informed decision. This process upholds the counselor's duty to protect client information and maintain trust. An incorrect approach would be to proceed with summarizing the information without any client involvement. This directly violates the ethical principle of confidentiality and potentially the legal framework governing client records and disclosures. The counselor has a duty to protect privileged communication, and any unauthorized disclosure, even in a summarized form, constitutes a breach. Another incorrect approach would be to assume that a general release of information signed at the beginning of services covers all future disclosures, including specific summaries for third parties. While initial consent forms may grant broad permission, ethical practice, and many legal statutes require specific consent for particular disclosures, especially when the purpose and recipient are clearly defined. This approach fails to ensure the client's ongoing informed consent for each distinct disclosure. Finally, an incorrect approach would be to provide a highly generalized, anonymized summary that omits all identifying details. While anonymization can be a strategy for sharing aggregate data, it is not a substitute for informed consent when specific client information is being summarized for a particular third party. The client still has a right to control the dissemination of their personal information, even if it is presented in a de-identified manner. if the intent is to share information about their specific case. The professional decision-making process for similar situations should begin with identifying the ethical and legal obligations related to confidentiality and informed consent. The counselor must then assess the client's capacity to provide consent. If consent is required, the counselor should clearly explain the nature of the information to be summarized, the purpose of the summary, and the identity of the recipient. The client should be given the opportunity to ask questions and to refuse consent without penalty. If consent is obtained, the summary should be accurate and limited to the information necessary for the stated purpose. Question 9. The monitoring system demonstrates that a client consistently attributes their own unacceptable impulses and feelings to others, often becoming angry or defensive when these projections are subtly pointed out. This pattern of behavior is most indicative of which psychodynamic defense mechanism? Option A, reaction formation. Option B, intellectualization. Option C, displacement. Option D, projection. The correct answer is D, projection. Explanation. This scenario presents a professional challenge because the counselor is observing a client's behavior that strongly suggests the manifestation of defense mechanisms, a core concept in psychodynamic theory. The challenge lies in accurately identifying and interpreting these mechanisms within the context of the client's therapeutic goals and the counselor's ethical obligations. Careful judgment is required to ensure that interpretations are not overly speculative, do not pathologize normal coping strategies, and are communicated in a way that is beneficial to the client's progress. The correct approach represents best professional practice because it aligns with the ethical guidelines for counselors, which emphasize the importance of using theoretical frameworks to understand client behavior and inform interventions. Specifically, identifying defense mechanisms like projection or denial, when supported by observable behavior and client narrative, allows the counselor to gain deeper insight into the client's internal world and the unconscious processes that may be contributing to their distress. This understanding can then guide the counselor in developing appropriate therapeutic strategies, such as exploring the underlying conflicts or facilitating the development of more adaptive coping mechanisms. This approach is consistent with the principle of beneficence, aiming to do good for the client by fostering self-awareness and facilitating growth. An incorrect approach that focuses solely on labeling the client's behavior as pathological without considering the psychodynamic context fails to acknowledge the potential adaptive function of defense mechanisms. This can lead to misdiagnosis and inappropriate interventions, potentially harming the client by invalidating their coping strategies. Ethically, this approach violates the principle of non-maleficence by potentially causing harm through misinterpretation and inappropriate treatment. Another incorrect approach that involves directly confronting the client with interpretations of their defense mechanisms without sufficient rapport or readiness on the client's part can be detrimental. This can lead to defensiveness, a breakdown in the therapeutic alliance, and resistance to further exploration. Ethically, this approach can be seen as a failure to respect the client's autonomy and readiness for insight, potentially causing psychological distress. A further incorrect approach that dismisses the relevance of psychodynamic concepts altogether in favor of a purely behavioral or cognitive perspective overlooks a significant dimension of human experience that psychodynamic theory seeks to illuminate. While other theoretical orientations have value, a complete disregard for unconscious processes and defense mechanisms can limit the counselor's ability to address deeply ingrained patterns of behavior and emotional regulation. This can be seen as a failure to provide comprehensive and potentially effective therapeutic care. The professional decision-making process for similar situations should involve a thorough assessment of the client's presentation, including their verbal and nonverbal communication. Counselors should draw upon their knowledge of various theoretical orientations, including psychodynamic theory, to formulate hypotheses about the underlying dynamics at play. Interventions should be tailored to the client's individual needs and readiness, with a focus on building a strong therapeutic alliance. Ethical considerations, such as client autonomy, beneficence, and non-maleficence, must guide all decisions. When interpreting psychodynamic concepts, counselors should do so tentatively and collaboratively with the client, allowing for exploration and validation rather than definitive pronouncements. Question 10. Governance review demonstrates that a counselor has been seeing a client who has expressed increasingly concerning thoughts about harming a specific individual outside of therapy. The client has not made concrete plans, but has described the individual in a way that suggests a strong emotional grievance. The counselor is aware of the potential for harm, but is also committed to maintaining the client's trust and the confidentiality of their therapeutic relationship. What is the most ethically and professionally sound course of action for the counselor in this situation? Option A. Immediately report the client's statements to law enforcement and the potential victim, as the expressed thoughts indicate a clear danger. Option B. Consult with a supervisor or legal counsel to discuss the situation and explore options for intervention, while continuing to assess the imminence and severity of the threat with the client. Option C. Discuss the client's statements with other counselors in the practice group to gain their perspectives on how to proceed, without identifying the client. Option D. Maintain strict confidentiality regarding the client's statements, as the client has not made concrete plans and the therapeutic relationship must be preserved at all costs. The correct answer is B. Consult with a supervisor or legal counsel to discuss the situation and explore options for intervention, while continuing to assess the imminence and severity of the threat with the client. Explanation. This scenario presents a professional challenge due to the inherent conflict between a counselor's duty to maintain client confidentiality and the potential need to protect a third party from harm. The counselor must navigate this ethical tightrope, balancing the client's trust with societal safety obligations. Careful judgment is required to determine the appropriate course of action, considering the severity of the threat, the client's intent, and legal mandates. The correct approach, which involves consulting with a supervisor or legal counsel and assessing the imminence and severity of the threat before taking any action that might breach confidentiality, represents best professional practice. This aligns with ethical codes that prioritize client welfare and confidentiality, while also acknowledging the counselor's responsibility to prevent harm. Specifically, it adheres to the principle of beneficence acting in the client's best interest, which includes helping them manage dangerous impulses and non-maleficence, avoiding harm to others. It also reflects the ACA Code of Ethics, 2014, Section B. 1. D. Confidentiality with third-party payers, and B. 2. A. Informing clients of limitations, which, while not directly about third-party threats, establish the framework for balancing confidentiality with legal and ethical obligations. The ACA Code of Ethics Section B. 1. C. Confidentiality exception explicitly states that counselors may disclose confidential information when necessary to prevent serious, foreseeable, and imminent harm to the client or others. This approach ensures that any breach of confidentiality is a last resort, carefully considered, and legally defensible. An incorrect approach that involves immediately reporting the client's statement to the authorities without further assessment or consultation would be professionally unacceptable. This fails to uphold the principle of client autonomy and the importance of the therapeutic relationship, potentially alienating the client and hindering future therapeutic progress. It also risks overreacting to a statement that may not represent an immediate or credible threat, thus violating the principle of proportionality. Furthermore, it bypasses the crucial step of seeking supervision or legal guidance, which is a cornerstone of ethical practice when facing complex dilemmas. Another incorrect approach, which is to ignore the client's statement due to a strict adherence to confidentiality, is also professionally unacceptable. This neglects the counselor's ethical and legal duty to protect potential victims when there is a clear and present danger. The ACA Code of Ethics Section B. 1. C. explicitly outlines exceptions to confidentiality for preventing harm. Ignoring such a statement could lead to serious harm to a third party and expose the counselor to legal and ethical repercussions. Finally, an incorrect approach that involves discussing the client's statement with colleagues not involved in the case without proper anonymization or consent would be a breach of confidentiality and professional ethics. This violates the principle of privacy and trust within the therapeutic relationship and could lead to the client being identified, even unintentionally. Professionals should employ a decision-making framework that begins with identifying the ethical issue, consulting relevant ethical codes and legal statutes, considering the potential consequences of each course of action, seeking supervision or consultation, and then making a reasoned decision. This process emphasizes careful deliberation, adherence to professional standards, and the protection of all parties involved. Question 11. System analysis indicates a counselor utilizing Gestalt therapy is working with a client who expresses a strong desire to overcome procrastination but consistently states, I just can't seem to get started, and it feels overwhelming to even think about it. The counselor, adhering to Gestalt principles, wants to help the client become more aware of their present experience of procrastination. Which of the following interventions best aligns with Gestalt therapy's focus on the here and now while respecting the client's current resistance? Option A. Advise the client to create a detailed daily schedule and break down tasks into smaller, manageable steps, focusing on behavioral change. Option B. Immediately suggest the client engage in an empty chair technique to confront the procrastination as an entity. Option C. Gently invite the client to describe any physical sensations or emotions they are experiencing right now as they talk about feeling overwhelmed by procrastination. Option D. Shift the focus to exploring the client's childhood experiences and how they might have learned to procrastinate. The correct answer is C. Gently invite the client to describe any physical sensations or emotions they are experiencing right now as they talk about feeling overwhelmed by procrastination. Explanation. Scenario analysis. This scenario presents a common challenge in counseling where a client's resistance to direct engagement with their present experience, a core tenet of Gestalt therapy, may stem from underlying avoidance mechanisms or a lack of trust. The counselor must navigate the client's expressed desire for change while respecting their current coping strategies and therapeutic readiness. The challenge lies in balancing the directive nature of Gestalt techniques with the client's pace and comfort level, ensuring the therapeutic alliance remains intact. Correct approach analysis. The most effective approach involves acknowledging the client's stated desire for change while gently guiding them back to the present moment and their immediate experience. This aligns with Gestalt principles of focusing on here and now awareness. By validating the client's feelings about the difficulty of the process, and then inviting them to explore their current physical sensations or emotional state related to the topic, the counselor facilitates self-discovery without forcing confrontation. This respects the client's autonomy and builds trust, essential for therapeutic progress within the ethical framework of the counseling profession, which emphasizes client welfare and informed consent. Incorrect approaches analysis. One incorrect approach would be to immediately dismiss the client's feelings of difficulty and insist on a specific Gestalt exercise, such as the empty chair technique, without adequate preparation or client buy-in. This could be perceived as coercive and may alienate the client, damaging the therapeutic relationship. Ethically, this disregards the client's readiness and could lead to premature termination or a negative therapeutic outcome. Another incorrect approach would be to abandon the Gestalt framework entirely and shift to a purely cognitive or behavioral approach without exploring the client's resistance within the Gestalt paradigm. While flexibility is important, a complete abandonment without understanding the root of the resistance within the client's present experience would be a failure to utilize the most appropriate theoretical orientation for the client's stated goals and the counselor's expertise. This could be seen as a failure to provide competent and appropriate care. A third incorrect approach would be to focus solely on the client's past experiences as the primary driver of their current difficulties, neglecting the Gestalt emphasis on present awareness. While past experiences inform the present, a persistent focus on the past, without connecting it to the client's current feelings and behaviors, would deviate from core Gestalt principles and might not facilitate the immediate experiential change the therapy aims for. This could be considered a misapplication of the therapeutic modality. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client-centeredness, ethical adherence, and theoretical integrity. This involves 1. Active listening to understand the client's stated needs and expressed difficulties. 2. Assessing the client's readiness for specific interventions, particularly those that might evoke strong emotions or require significant self-disclosure. 3. Applying theoretical principles flexibly, adapting techniques to the client's current state and therapeutic alliance. 4. Continuously monitoring the client's response and adjusting the approach accordingly, ensuring interventions are beneficial and not harmful. Question 12. The audit findings indicate that a counselor has been working with a client who consistently arrives late to sessions and frequently cancels appointments with little notice, significantly disrupting the therapeutic flow and hindering progress towards the client's stated goals of managing anxiety. The counselor has observed that these behaviors seem to be linked to the client's avoidance of discussing certain difficult topics during sessions. The counselor is considering how to best address this pattern using principles from behavioral theories, Which of the following represents the most ethically sound and theoretically appropriate approach? Option A. Focus exclusively on the client's underlying anxiety and explore their feelings about the difficult topics, assuming that addressing the emotional core will naturally resolve the attendance issues. Option B. Refer the client to another counselor, stating that their attendance issues are beyond the scope of what can be effectively addressed in this therapeutic relationship. Option C. Collaboratively explore with the client the antecedents and consequences of their lateness and cancellations, identifying potential reinforcers for these behaviors and developing strategies together to increase session attendance and engagement. Option D. Implement a strict policy of charging a full session fee for any cancellation with less than 24 hours notice, without further discussion, to deter future cancellations. The correct answer is C. Collaboratively explore with the client the antecedents and consequences of their lateness and cancellations, identifying potential reinforcers for these behaviors and developing strategies together to increase session attendance and engagement. Explanation. Scenario analysis. This scenario presents a professional challenge because the counselor is faced with a client whose behavior is impacting their ability to engage in therapy, and the counselor must decide on the most effective and ethical course of action. The challenge lies in balancing the client's immediate needs with the long-term goals of therapy, while adhering to professional ethical standards and the principles of behavioral theory. The counselor must consider the client's autonomy, the therapeutic alliance, and the potential for positive change. Correct approach analysis. The most appropriate approach involves a collaborative exploration of the client's behavior within the context of their stated goals. This aligns with the principles of behavioral theories, particularly those emphasizing the role of reinforcement, antecedent conditions, and consequences in shaping behavior. By working with the client to identify triggers and reinforcers, the counselor can help the client develop self-awareness and self-efficacy. This collaborative process respects the client's agency and fosters a stronger therapeutic alliance, which is crucial for successful treatment. It also allows for the application of behavioral interventions in a way that is tailored to the individual client's unique circumstances and motivations, promoting sustainable change. This approach is ethically sound as it prioritizes client welfare and informed consent. Incorrect approach is analysis. One incorrect approach would be to immediately implement a strict behavioral modification plan without client input or understanding. This fails to acknowledge the client's role in their own treatment and can lead to resistance, a damaged therapeutic alliance, and a sense of disempowerment. Ethically, this violates principles of informed consent and client autonomy. From a behavioral theory perspective, it overlooks the importance of the client's internal motivation and the potential for negative reinforcement of compliance due to fear of consequences, rather than genuine behavioral change. Another incorrect approach would be to dismiss the behavioral issues as outside the scope of counseling, or to simply refer the client, without attempting to understand or address the presenting problem. This is a failure to provide competent and comprehensive care. Ethically, it could be seen as abandonment or a lack of diligence in addressing the client's needs. Behaviorally, it misses an opportunity to apply relevant principles that could significantly benefit the client. A third incorrect approach would be to focus solely on the client's thoughts and feelings without addressing the observable behaviors that are hindering progress. While cognitive and affective components are important, behavioral theories specifically highlight the impact of actions and their consequences. Ignoring the behavioral aspect would be a misapplication of behavioral principles and could lead to a superficial understanding of the problem, limiting the effectiveness of the intervention. Ethically, this could result in ineffective treatment. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the presenting problem, considering the client's goals and the observable behaviors. This assessment should be followed by a collaborative discussion with the client about potential interventions, drawing upon relevant theoretical frameworks such as behavioral theories. The counselor should then jointly develop a treatment plan that is clearly explained to the client, ensuring informed consent. Throughout the process, ongoing evaluation of the client's progress and adjustment of the plan based on feedback and observed outcomes are essential. This iterative process ensures that the intervention remains client-centered, ethically sound, and theoretically grounded. Question 13. Stakeholder feedback indicates a desire for more insight into the general impact and effectiveness of the counseling services provided. As a counselor, How would you best respond to this feedback while strictly adhering to the ethical guidelines of the American Counseling Association, a CAC Code of Ethics? Option A. Decline to provide any feedback or insights, citing the absolute need for client confidentiality in all circumstances. Option B. Request permission from each past client to share their case details in a generalized summary of service impact. Option C. Share anonymized but specific examples of client challenges and how they were addressed in sessions to illustrate the service's impact. Option D. Compile a report summarizing general themes and observed outcomes from client progress, without referencing any specific client details or identifiable information. Correct answer is D. Compile a report summarizing general themes and observed outcomes from client progress, without referencing any specific client details or identifiable information. Explanation. This scenario presents a professional challenge because it requires a counselor to navigate potentially sensitive client information and the ethical obligation to maintain confidentiality, while also responding to a broad request for feedback that could inadvertently solicit protected details. The counselor must balance the desire to be responsive and gather useful input with the paramount duty to protect client privacy, as mandated by the American Counseling Association, a CA Code of Ethics. The correct approach represents best professional practice because it directly addresses the stakeholder feedback in a way that respects client confidentiality and adheres to ethical guidelines. By focusing on general themes and aggregate data, the counselor avoids disclosing any specific client information, thereby upholding the ACA Code of Ethics, specifically Section B. 1. C. Confidentiality. This approach also demonstrates a commitment to professional development and program improvement by seeking feedback in a manner that is both informative and ethically sound. An incorrect approach that involves sharing specific client anecdotes or verbatim comments, even if anonymized, poses a significant ethical failure. This violates ACA Code of Ethics Section B. 1. A. Informed consent in confidentiality, and B. 1. C. Confidentiality, as it risks identifying individuals and breaching the trust inherent in the therapeutic relationship. Even with anonymization, the risk of re-identification or the perception of a breach can be substantial. Another incorrect approach, refusing to gather any feedback at all, fails to meet the professional responsibility to seek continuous improvement and respond to stakeholder needs, as implied by the initial feedback. While prioritizing confidentiality is crucial, a complete refusal can be seen as a lack of engagement and a missed opportunity for growth, potentially contradicting the spirit of professional development and client-centered practice. The professional decision-making process for similar situations should involve a careful assessment of the request against ethical codes and legal mandates. Counselors should first identify the core intent of the feedback request. Then, they should brainstorm methods of gathering information that are ethically permissible and do not compromise client confidentiality. This often involves abstracting themes, using aggregated data, or focusing on process rather than specific client content. If a request cannot be fulfilled ethically, the counselor should communicate this clearly and offer alternative, ethical methods for achieving the desired outcome. Question 14. The performance metrics show a significant increase in client engagement following the implementation of a new therapeutic technique. During a session, a client asks for a detailed explanation of the underlying theoretical principles of this technique, which involve complex psychological constructs and research terminology. The counselor needs to explain these principles to the client. Option A. Summarize the theoretical principles by focusing only on the most basic aspects, omitting any details that might be perceived as too complicated, even if it alters the original meaning. Option B. Rephrase the theoretical principles using simpler language, analogies, and examples that are relevant to the client's experience, ensuring the core concepts and their implications are accurately conveyed. Option C. Directly read the technical definitions and research findings from the source material, assuming the client will understand the complex terminology. Option D. Integrate personal interpretations and anecdotal evidence into the explanation, framing them as established facts of the technique. The correct answer is B. Rephrase the theoretical principles using simpler language, analogies, and examples that are relevant to the client's experience, ensuring the core concepts and their implications are accurately conveyed. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the counselor to accurately and ethically convey complex information to a client without misrepresenting the original meaning. The risk lies in inadvertently distorting the client's understanding, which can lead to poor decision-making, erosion of trust, and potential harm. The counselor must balance the need for clarity with the imperative of fidelity to the original source material. Correct approach analysis. The correct approach involves rephrasing the information in a way that is easily understood by the client, using simpler language and avoiding jargon, while ensuring that the core meaning and intent of the original statement are preserved. This aligns with ethical principles of client welfare and informed consent, as it empowers the client with accurate and comprehensible information. It also reflects professional competence in communication. Incorrect approaches analysis. One incorrect approach involves directly quoting technical terms without explanation. This fails to meet the client's need for understanding and can lead to confusion or misinterpretation, violating the principle of client welfare. It also demonstrates a lack of communication skill. Another incorrect approach is to oversimplify to the point of losing critical nuances or altering the original meaning. This misrepresents the information and can lead the client to make decisions based on flawed understanding, which is an ethical breach of honesty and competence. A third incorrect approach is to introduce personal opinions or interpretations not present in the original information. This compromises objectivity and can unduly influence the client's perspective, violating professional boundaries and the principle of providing accurate information. Professional reasoning. Professionals should employ a decision-making process that prioritizes client understanding and ethical integrity. This involves first thoroughly understanding the original information, then considering the client's background and comprehension level, and finally rephrasing the information using clear, accessible language while rigorously maintaining fidelity to the original meaning. When in doubt, seeking clarification or using a more direct, albeit potentially less simplified, explanation is preferable to misrepresentation. Question 15. Cost-benefit analysis shows that a particular evidence-based therapeutic modality has a high success rate for anxiety disorders. A new client presents with significant anxiety symptoms, but their cultural background emphasizes spiritual healing and community support as primary coping mechanisms, and they express skepticism about Western psychological interventions. What is the most ethically sound course of action for the counselor? Option A. Gently explain to the client that their cultural beliefs are not compatible with effective psychological treatment and that they may need to set those beliefs aside to benefit from therapy. Option B. Refer the client to a spiritual leader or community elder, as their cultural background suggests these are the primary sources of healing, and the counselor's expertise may not be relevant. Option C. Discuss the client's cultural beliefs and preferences regarding healing and explore how the evidence-based modality can be adapted or integrated with their existing coping strategies, while also educating them about the potential benefits of the modality. Option D. Proceed with implementing the evidence-based therapeutic modality as it is known to be effective, assuming the client will eventually see its value regardless of their initial cultural reservations. The correct answer is C. Discuss the client's cultural beliefs and preferences regarding healing and explore how the evidence-based modality can be adapted or integrated with their existing coping strategies, while also educating them about the potential benefits of the modality. Explanation. This scenario is professionally challenging because it requires the counselor to balance the client's immediate expressed needs with the counselor's ethical obligations and understanding of potential cultural misunderstandings. The counselor must navigate the client's cultural background, which may influence their perception of mental health services and their willingness to engage with certain therapeutic modalities. The core of the challenge lies in ensuring that the counselor's interventions are culturally sensitive and do not inadvertently impose dominant cultural norms or values. The correct approach represents best professional practice because it prioritizes client autonomy and cultural humility. By actively seeking to understand the client's cultural context and preferences, the counselor demonstrates respect and builds trust. This collaborative approach, which involves discussing and adapting interventions to align with the client's worldview, is consistent with ethical guidelines that mandate culturally competent counseling. It ensures that the client receives services that are not only effective, but also respectful of their identity and background, thereby promoting positive therapeutic outcomes and upholding the counselor's responsibility to avoid harm. An incorrect approach that involves immediately implementing a standard, culturally bound therapeutic technique without exploring the client's cultural perspective would be ethically flawed. This failure to assess cultural factors could lead to misinterpretation of the client's behavior, ineffective treatment, and potential alienation of the client. It violates the principle of cultural competence, which requires counselors to be aware of and sensitive to their clients' cultural backgrounds. Another incorrect approach, such as dismissing the client's cultural concerns as irrelevant to the therapeutic process, would be a direct violation of ethical standards that emphasize client welfare and non-discrimination. This demonstrates a lack of cultural humility and an imposition of the counselor's own cultural biases. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases. This is followed by a thorough cultural assessment of the client, which involves open-ended questioning about their values, beliefs, and preferences regarding mental health and treatment. The counselor should then collaboratively develop a treatment plan that integrates the client's cultural background with evidence-based practices, adapting interventions as necessary. This process emphasizes ongoing dialogue and flexibility, ensuring that the client's cultural identity is respected and integrated throughout the therapeutic journey. Question 16. The assessment process reveals a client who expresses profound feelings of emptiness, a sense of being disconnected from others, and a pervasive belief that life lacks inherent purpose. The client states, "I feel like I'm just going through the motions, and nothing I do really matters in the grand scheme of things." The counselor, trained in existential therapy, needs to determine the most appropriate initial therapeutic focus. Option A. Provide the client with a structured list of volunteer opportunities and hobbies to help them find purpose. Option B. Shift the focus to exploring specific past traumatic events that may have contributed to their current feelings of emptiness. Option C. Challenge the client's cognitive distortions that lead them to believe their life is meaningless. Option D. Facilitate an exploration of the client's subjective experience of freedom, responsibility, isolation, and the search for meaning in their life. The correct answer is D. Facilitate an exploration of the client's subjective experience of freedom, responsibility, isolation, and the search for meaning in their life. Explanation. This scenario presents a professional challenge because the client's existential distress is deeply intertwined with their personal history and their perception of meaninglessness, which can be difficult to untangle and address effectively. The counselor must navigate the client's profound feelings of isolation and lack of purpose without imposing their own values or offering simplistic solutions. Careful judgment is required to ensure the therapeutic approach is congruent with existential principles and respects the client's autonomy. The correct approach represents best professional practice because it directly addresses the core tenets of existential therapy. By exploring the client's subjective experience of freedom, responsibility, isolation, and meaninglessness, the counselor facilitates the client's own process of confronting these fundamental human concerns. This aligns with the ethical guidelines for counselors, which emphasize client self-determination and the importance of working within one's theoretical orientation. The focus on the client's lived experience and their search for meaning is central to existential practice and promotes genuine self-discovery. An incorrect approach that focuses solely on cognitive distortions would fail to acknowledge the existential nature of the client's suffering. While cognitive distortions may be present, they are likely a symptom of a deeper existential crisis rather than the root cause. This approach would be ethically problematic, as it might oversimplify the client's experience and lead to a superficial intervention that does not address the client's core concerns. It could also be seen as a failure to adhere to the counselor's theoretical framework if existential therapy is the chosen modality. Another incorrect approach that involves immediately providing a list of activities to create meaning would be premature and potentially invalidating. Existential therapy emphasizes that meaning is not found in external activities alone, but is created through engagement with life and acceptance of one's freedom and responsibility. Imposing a list of activities bypasses the client's own exploration and can feel prescriptive, undermining their sense of agency. This would be a failure to respect the client's journey and could be considered an ethical lapse in providing appropriate therapeutic care. A third incorrect approach that involves focusing on past trauma without an existential lens would miss the core of the client's current distress. While past experiences can contribute to feelings of meaninglessness, the existential framework focuses on the present confrontation with life's givens. Shifting the focus solely to past trauma without connecting it to the client's current existential concerns would be a deviation from the chosen therapeutic model and could lead to an incomplete and ineffective treatment plan. The professional decision-making process for similar situations involves first accurately assessing the client's presenting concerns through the lens of the chosen theoretical orientation. If existential therapy is indicated, the counselor must then apply its core principles to understand the client's experience. This involves active listening, empathic reflection, and facilitating the client's exploration of their freedom, responsibility, isolation, and search for meaning. Interventions should be derived from this understanding and always prioritize the client's autonomy and the therapeutic relationship. Counselors must remain within their scope of practice and theoretical competence, ensuring that their interventions are ethically sound and aligned with professional standards. Question 17. The efficiency study reveals that a counselor is meeting with a new client who expresses feeling overwhelmed and states, "I just don't want to be a burden anymore." The counselor wants to build rapport and demonstrate empathy. Which of the following actions best balances empathy with the immediate need for risk assessment? Option A. Immediately offer coping strategies and resources for managing stress and feeling like a burden. Option B. Gently ask clarifying questions about what specifically is overwhelming the client and if they have had thoughts of harming themselves. Option C. Focus solely on validating the client's feelings of being overwhelmed and a burden without further inquiry. Option D. Share personal anecdotes about times the counselor felt overwhelmed to create a connection. The correct answer is B. Gently ask clarifying questions about what specifically is overwhelming the client and if they have had thoughts of harming themselves. Explanation. This scenario presents a professional challenge because the counselor must balance the client's immediate emotional distress with the ethical imperative to conduct a thorough risk assessment. The client's vague statements about feeling overwhelmed and not wanting to be a burden could indicate a range of issues, from mild situational stress to suicidal ideation. A rushed or superficial approach to empathy building without adequately assessing risk could have severe consequences. The correct approach represents best professional practice because it prioritizes client safety while still acknowledging and validating the client's feelings. By gently probing for more specific information about the client's thoughts and intention, the counselor is fulfilling their ethical duty to assess and manage risk. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Specifically, ethical guidelines for counselors in the U.S., such as those from the American Counseling Association, ACA, mandate that counselors take reasonable steps to assess and address suicidal risk when it is present. This involves direct questioning about suicidal thoughts, plans, and intent. An incorrect approach that focuses solely on validating feelings without assessing risk fails to uphold the counselor's duty of care. This could be considered a breach of ethical standards by potentially overlooking a life-threatening situation. Another incorrect approach that immediately jumps to problem-solving or offering solutions without fully understanding the client's emotional state and risk level bypasses crucial steps in building rapport and assessing the situation. This can alienate the client and prevent the counselor from gathering necessary information. Third incorrect approach that involves sharing personal experiences to build empathy, while sometimes useful, can be premature and detract from the primary goal of risk assessment in a crisis situation. It can also blur professional boundaries and shift the focus away from the client's needs. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's immediate safety and well-being. This involves active listening, empathetic reflection, and direct, yet sensitive, questioning to gauge the level of risk. Once safety is addressed, the counselor can then proceed with more in-depth therapeutic interventions. This systematic approach ensures that the client's immediate needs are met while adhering to ethical and legal obligations. Question 18. Process analysis reveals that a counselor is working with a client who exhibits significant anxiety in social situations, which appears to have developed after observing a parent's highly anxious interactions in similar settings. The counselor is considering various intervention strategies. Which of the following approaches most directly aligns with the principles of social learning theory in addressing this client's social anxiety? Option A. Focusing solely on challenging the client's negative self-talk and catastrophic thinking related to social events. Option B. Exploring the client's early childhood experiences and unconscious conflicts that may have led to their social anxiety. Option C. Guiding the client to identify and analyze the observed anxious behaviors of their parent, and then exploring alternative, more confident social behaviors through role-playing and modeling. Option D, implementing a system of direct rewards for the client's successful social interactions, without exploring the origins of their anxiety. Correct answer is C, guiding the client to identify and analyze the observed anxious behaviors of their parent, and then exploring alternative, more confident social behaviors through role-playing and modeling. Explanation. Scenario analysis. This scenario presents a professional challenge because a counselor is attempting to address a client's maladaptive behavior without fully understanding the underlying mechanisms of its acquisition. Relying solely on direct intervention without considering the client's observational learning experiences risks an incomplete or ineffective treatment plan. Careful judgment is required to select an intervention that aligns with established psychological principles and the client's unique developmental and environmental context. Correct approach analysis. The correct approach, which involves identifying and modifying observational learning patterns, represents best professional practice because it directly addresses the principles of social learning theory. This theory, as espoused by Bandura, posits that individuals learn behaviors, attitudes, and emotional reactions through observation, imitation, and modeling. By understanding that the client may have learned their current coping mechanisms by observing others, the counselor can more effectively guide the client in identifying positive role models, practicing new behaviors, and developing self-efficacy in adopting healthier responses. This aligns with the ethical imperative to provide evidence-based and client-centered care, ensuring interventions are grounded in sound psychological principles. Incorrect approach is analysis. An approach that focuses exclusively on direct reinforcement of desired behaviors without exploring the observational roots of the maladaptive behaviors fails to fully address the client's learning history. While reinforcement is a component of learning, it overlooks the significant role of vicarious learning and modeling central to social learning theory. This could lead to superficial changes that are not deeply integrated. An approach that solely emphasizes cognitive restructuring without acknowledging the observational influences on the client's thought patterns is also incomplete. While cognitive processes are crucial, social learning theory highlights how observed behaviors and their consequences can shape cognitive schemas and beliefs. Ignoring this observational component may limit the effectiveness of cognitive interventions. An approach that relies solely on psychodynamic interpretations of unconscious drives as the primary cause of the behavior neglects the explicit principles of social learning theory, which focuses on observable behaviors and their environmental and social determinants. While psychodynamic perspectives may offer valuable insights in some contexts, they are not the primary framework for understanding learning through observation and modeling. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting problem, considering multiple theoretical perspectives. When social learning theory is relevant, as indicated by the client's history or the nature of the behavior, the professional should prioritize interventions that address observational learning, modeling, and self-efficacy. This involves a systematic evaluation of the client's environment, significant others, and past experiences of learning through observation. Ethical practice demands that interventions are not only effective, but also tailored to the individual client's needs and grounded in empirically supported theories. Question 19. Strategic planning requires a counselor to anticipate and address potential ethical and legal dilemmas. A counselor is working with a 16-year-old client who discloses experiencing physical discipline from their parents that the client describes as really hard and causing bruises. The client expresses fear of further punishment if they report this to anyone. The counselor suspects this may constitute child abuse. What is the most ethically and legally sound course of action for the counselor? Option A. Immediately report the suspected child abuse to the appropriate Child Protective Services agency, while also attempting to inform the client about the limits of confidentiality and the necessity of the report. Option B. Delay reporting until the client explicitly states they want to report the abuse, or until the counselor obtains undeniable proof of severe physical harm. Option C. Advise the client to speak directly with their parents about the discipline and encourage them to seek family counseling to resolve the issues. Option D. Assure the client that their information will remain confidential and continue to explore the situation further with the client to gather more definitive evidence of abuse. The correct answer is A. Immediately report the suspected child abuse to the appropriate Child Protective Services agency, while also attempting to inform the client about the limits of confidentiality and the necessity of the report. Explanation. This scenario presents a professional challenge due to the inherent conflict between a counselor's duty to protect a client's confidentiality and the legal obligation to report suspected child abuse. Navigating this requires careful judgment to balance these competing ethical and legal demands. The correct approach prioritizes the legal mandate to report suspected child abuse, as mandated by state laws and professional ethical codes that supersede confidentiality in such critical situations. This aligns with the ACA Code of Ethics, specifically the section on confidentiality and disclosure of confidential information, which outlines exceptions for legally mandated reporting of child abuse. The counselor's immediate action to report to the appropriate authorities, while also attempting to inform the client of the limits of confidentiality, represents best professional practice by adhering to legal obligations and attempting to maintain therapeutic rapport as much as possible within those constraints. An incorrect approach would be to solely rely on the client's assurance without verifying the situation, as this fails to uphold the legal duty to protect a potentially endangered child. This disregards the counselor's legal reporting obligations and the ethical imperative to prioritize client welfare when there is a reasonable suspicion of harm. Another incorrect approach would be to immediately break confidentiality and report without first attempting to discuss the situation with the client, if feasible and safe to do so. While reporting is necessary, the ideal ethical practice involves informing the client about the limits of confidentiality and the necessity of reporting, whenever possible, to preserve the therapeutic relationship and client autonomy. This approach fails to consider the client's right to be informed about the disclosure of their information. A further incorrect approach would be to delay reporting until further evidence is gathered, as this could put the child at continued risk and violate the legal requirement for prompt reporting of suspected abuse. The legal standard often requires reporting based on reasonable suspicion, not definitive proof. Professionals should utilize a decision-making framework that begins with identifying the ethical and legal obligations. In cases of suspected child abuse, the legal mandate to report is paramount. The counselor should then assess the immediacy of the danger and the feasibility of discussing the situation with the client before reporting, always prioritizing the safety of the child. Consultation with a supervisor or legal counsel is also a crucial step in complex ethical dilemmas. Question 20. The evaluation methodology shows that a client is experiencing significant distress stemming from deeply held existential beliefs about the meaning of life and their place in the universe. The counselor is considering how to best address this distress, balancing the client's subjective experience with therapeutic efficacy. Which of the following approaches most closely aligns with humanistic theories and best professional practice for this scenario? Option A. Immediately reframe the client's existential concerns as cognitive distortions and implement cognitive restructuring techniques to challenge and replace these beliefs. Option B. Facilitate the client's exploration of their existential concerns through active listening, empathy, and unconditional positive regard, empowering them to find personal meaning and solutions. Option C. Focus exclusively on symptom reduction techniques, such as relaxation exercises, without delving into the underlying existential framework that is causing the distress. Option D. Introduce the counselor's own philosophical or spiritual beliefs to offer alternative perspectives and guide the client toward a more correct understanding of existence. The correct answer is B. Facilitate the client's exploration of their existential concerns through active listening, empathy, and unconditional positive regard, empowering them to find personal meaning and solutions. Explanation. This scenario presents a professional challenge because the counselor must integrate a client's deeply held existential beliefs, which are central to their identity and distress, with evidence-based therapeutic interventions. The difficulty lies in respecting the client's humanistic worldview without imposing personal beliefs or dismissing the validity of their subjective experience, all while adhering to ethical guidelines that mandate client autonomy and well-being. Careful judgment is required to ensure the therapeutic alliance remains strong and that interventions are culturally sensitive and client-centered. The correct approach represents best professional practice because it aligns with the core tenets of humanistic psychology, emphasizing the client's inherent worth, self-actualization, and subjective experience. By focusing on empathy, unconditional positive regard, and congruence, the counselor facilitates the client's exploration of their existential concerns and empowers them to find their own meaning and solutions. This approach respects client autonomy, as mandated by ethical codes such as the ACA Code of Ethics, which prioritizes client welfare and self-determination. It also aligns with the NCE's emphasis on person-centered care and the counselor's role in fostering growth and resilience. An incorrect approach that dismisses the client's existential beliefs as mere philosophical musings and immediately redirects to cognitive restructuring fails to acknowledge the profound impact of these beliefs on the client's emotional state and life choices. This is an ethical failure because it invalidates the client's subjective reality and can damage the therapeutic relationship, potentially leading to client disengagement. It also violates the principle of client autonomy by imposing a framework that may not resonate with the client's values. Another incorrect approach that attempts to correct the client's existential beliefs by presenting alternative philosophical viewpoints or religious doctrines is a significant ethical breach. This constitutes imposing personal values and beliefs, which is strictly prohibited by professional ethical standards. It undermines the counselor's objectivity and neutrality, and can lead to a power imbalance where the client feels judged or coerced rather than supported. This directly contravenes the NCE's focus on non-directive, client-led exploration, a further incorrect approach that focuses solely on symptom reduction without exploring the underlying existential meaning contributing to the distress, overlooks the holistic nature of human experience. While symptom management is important, humanistic theories posit that true healing often involves confronting and integrating deeper existential questions. Failing to address these can lead to superficial change or a recurrence of issues, as the root cause remains unaddressed. This is a failure to provide comprehensive care as expected by NCE standards. The professional decision-making process for similar situations involves first establishing a strong therapeutic alliance built on trust and empathy. The counselor should actively listen to and validate the client's existential concerns, seeking to understand their unique perspective. Interventions should then be collaboratively developed, drawing from humanistic principles to facilitate self-exploration and meaning-making. The counselor must remain aware of their own biases and ethical obligations, ensuring that the client's autonomy and well-being are always prioritized.